the scars you can't see. In 2014, a psychiatrist published a book that became one of the best-selling books of the decade. It had one central claim: you cannot think your way out of what happened to your body. The body keeps the score. And 2,600 years earlier, on the other side of the world, and by a completely different road, a teacher opened his most influential instruction the same way. Begin with the body. Buddhism and modern trauma science arrived at the same location by very different routes. Not the same destination, the same location. Tonight, where they meet, and where they go their separate ways. You've spent a lifetime being told to talk it out, reason it through, get over it. Two traditions, 26 centuries apart, arrived at the same quiet correction. Start lower than thought. Tonight, where they agree, and the exact point where their paths split. Chapter 1. Where they converge. Van der Kolk's central claim. In his own words, trauma is not the story of something that happened back then. It's the current imprint of that pain, horror, and fear living inside people. Notice the word imprint, singular. Not memories, not stories, not what you remember. An imprint. Something pressed into the body that continues to shape how the body responds, long after the original event is over. The nervous system does not know the trauma is over. The body reacts to a present cue, a smell, a tone of voice, a certain angle of light, as if the past event was still happening, right now. For most of the 20th century, the dominant treatment for trauma was talk. Freud's talking cure, cognitive behavioral therapy, trauma-focused CBT, prolonged exposure through verbal recounting. The assumption underneath all of them: if the patient can articulate what happened, understand it, integrate it into a coherent narrative, the symptoms will lift. Insight leads to relief. Words lead to healing. Van der Kolk spent 40 years watching that assumption fail for his most severely traumatized patients. Not for everyone. Talking therapies help many people in many circumstances, but for a substantial subset of trauma survivors, 30 sessions of skilled talk therapy left the flashbacks unchanged, the startle response unchanged, the chronic dissociation unchanged. Something else was going on. Something that words alone could not reach. In 1996, Van der Kolk co-authored a small imaging study that became one of the most cited pieces of evidence for the body-based turn in trauma treatment. 8 patients with PTSD were placed in a PET scanner. Each patient's own trauma narrative was read to them while their brains were imaged. Under this provocation, activation dropped in Broca's area, the region of the brain most closely associated with expressive language. That is the finding, and it was striking. But the study had real limitations that need to be named. There was no control group. The trauma scripts were self-generated by the patients themselves, which raises a circularity problem. There was no comparison to intense but non-traumatic memory. It was an early, imperfect glimpse, subsequently partially replicated by Shin and colleagues in 1997, of something that might be happening in the brain during traumatic activation. Not a settled fact, but a signal worth following. Van der Kolk's gloss on that signal became the phrase that traveled: speechless terror. During the height of traumatic re-experiencing, the part of the brain that puts experience into words appears to go offline. This is his interpretive framing, and it is more assertive than the study alone can carry. But it names something clinicians had been observing for decades. Patients would try to speak about what happened and find that the words were simply not there. The event was in them, It was not in language. If words were not enough, then the treatment had to reach the body directly. Van der Kolk and his colleagues began testing body-based interventions, yoga, EMDR, sensory-motor psychotherapy, theatre, drumming, neurofeedback, not as adjuncts to talk therapy, but as primary interventions for severe cases. In 2014, his research group published a randomized controlled trial in the Journal of Clinical Psychiatry, testing a specific yoga protocol against a control condition for women with chronic, treatment-resistant PTSD. After 10 weeks, 52% of the yoga group no longer met diagnostic criteria for PTSD. In the control group, 21%. The effect size was large enough to be clinically meaningful, and it was reached without a single verbal recounting of the trauma. This is what Van der Kolk means when he says the body keeps the score. Not a metaphor, a working clinical claim. The imprint of trauma is held in the body's own patterns of response, and the way to reach it is through the body itself. His instruction to patients under this framework has become one of his signatures. Notice that. What happens next? No interpretation demanded, no narrative required, just attention to what is arising right now in the body and permission for it to change on its own. Now the other road. 2,500 years earlier, in the plains of northern India, a teacher gave his students a set of instructions on how to establish stable awareness. The discourse is preserved in the Pali Canon as MN10, the Satipatthana Sutta, the Four Foundations of Mindfulness. It is arguably the most influential single text on meditative practice in the Buddhist tradition, and it opens with an unusual choice. Of the four foundations that will structure the practice, body, feeling tone, mind, mental objects, the first is the body, kāya-nupassana. And of the many possible objects of body attention that could come first, the sutta chooses one, the breath. Not the most important object necessarily, the most accessible, the one that is always available, always changing, always present, always here. The instruction is very specific. Breathing in long, the practitioner discerns, I am breathing in long. Breathing out long, I am breathing out long. There is no interpretation asked of the meditator, no narrative to construct, no story about what the breath means, just attention to what is arising right now in the body. Just notice. And then, as the practice develops, a very particular training. He trains himself. I will breathe in calming bodily fabrication. I will breathe out calming bodily fabrication. Calming bodily fabrication. That phrase carries the weight of an entire theory of what the body is and what practice does to it. To understand it, we need a companion text in another discourse, MMN 44. The Kulavadala Sutta. A nun named Dhammadinna is asked about the different types of fabrication in the body-mind. Her answer, in the translation of Thanissaro Bhikkhu, in and out breaths are bodily fabrications. Directed thought and evaluation are verbal fabrications. Perceptions and feelings are mental fabrications. She continues, in and out breaths are bodily. These are things tied up with the body. That's why in and out breaths are bodily fabrications. The Pali term she is using is kāya-saṅkhāra, and this is one of the most important technical concepts in the tradition for understanding what happens next. Sankhara, roughly, means fabrication, or formation, or conditioning. It is not just a thought or a habit. It is the accumulated pattern of how experience gets put together, how one moment shapes the next, how past conditioning shows up as present response. Kāya-saṅkhāra is the specifically bodily layer of that conditioning, and Dhammadinna names the primary vehicle for it, the breath, which means that when MN10 instructs the meditator to breathe in calming bodily fabrication, it is not asking for a general state of relaxation. It is naming the exact mechanism of change. The breath is not just a focus object. It is the interface between the body's stored patterns and the possibility of a different response. Change the breath, and the bodily pattern begins, slowly, to shift. Thanisaro Bhikkhu, in an essay on the psychology of practice, puts the point in a sentence that could sit inside a modern clinical manual without editing. The way you breathe shapes the way you feel. That is not two traditions borrowing from each other. That is two independent lineages, working with utterly different instruments, a PET scanner and a stilled mind, arriving at the same starting place: the body, the breath, the sensation that arises before the story. The convergence deserves to be stated precisely because the shape of it matters. It is not that Buddhism anticipated trauma science. It is not that van der Kolk rediscovered a truth Buddhists had known for millennia. Those framings flatten what actually happened. Two investigators, working 26 centuries apart, by completely different roads, kept finding themselves at the same location. Attend here, in this breath, in this body, and something shifts. Van der Kolk arrived by watching what talk therapy could not reach. The Buddhist tradition arrived by asking what conditions experience so that suffering keeps arising. Different starting questions. Same first stop on the road. There is a modern current that has tried to formalize this convergence, and it needs to be named honestly. Since the late 1970s, a whole clinical field has grown up around what is now called mindfulness. Jon Kabat-Zinn founded the mindfulness-based stress reduction program at the University of Massachusetts Medical Center in 1979, drawing explicitly on techniques from the Buddhist tradition, but stripping them of their doctrinal framing so they could be studied in medical journals and reimbursed by insurance. MBSR is now embedded in hospitals, veterans clinics, and trauma treatment centers around the world. It has helped enormous numbers of people. It also is not the same thing as MN10's 4 foundations of mindfulness. Bhikkhu Bodhi, one of the most careful contemporary translators of the Pali Canon, has made the point directly. Right mindfulness, samasati, in the traditional framework is always guided by right view, steered by right intention, and grounded in the 3 ethical factors of the Eightfold Path. It is aimed at liberation from suffering, not at symptom reduction. MBSR does not frame practice this way. This is not a criticism. It is a clarification. The clinical adaptation is doing one thing. The traditional practice is doing another. Both can be useful. They are not identical, and pretending they are does justice to neither. One of the clearest bridge figures between the two worlds is the psychiatrist Mark Epstein, who has practiced both Buddhist meditation and psychodynamic therapy for 4 decades. His book, The Trauma of Everyday Life, argues that the word dukkha, usually translated as suffering, carries the literal meaning of hard to face. Ordinary human life in this reading contains a background layer of trauma that the Buddha himself worked through in his own biography. Epstein's project runs parallel to van der Kolk's work rather than building on it. He is a Buddhist clinician who has navigated both traditions with unusual care, and his framing is useful. It also risks reducing satipatthana to a therapy of adaptation, when the 4 noble truths are structured differently, as a physician's diagnosis and a complete cure, not a management protocol. One more piece of the modern clinical picture needs to be handled with care, because it sits underneath much of what gets said in trauma-informed spaces. Stephen Porges's Polyvagal Theory has given trauma clinicians a shared vocabulary for the nervous system, states of safety and danger, dysregulation, co-regulation, the window of tolerance. That clinical language has documented practical value in trauma work. Patients report benefit. Therapists report clinical traction. The underlying neuroanatomical mechanism, however, is currently under active dispute. Earlier this year, Grossman and colleagues published a review in Clinical Neuropsychiatry, concluding that polyvagal theory is untenable on existing neurophysiological and evolutionary evidence. Porges responded in the same issue, defending the model. The debate is unresolved. The honest framing is this: the clinical map has real utility, and the specific wiring it proposes is contested among specialists. When we use the language of nervous system states in what follows, we are using it as an influential clinical map, not as settled neuroscience. That distinction matters because a serious audience deserves the actual state of the evidence, not a smoothed-over consensus that does not exist. Two traditions, 26 centuries apart, same starting location. In the chapter that follows, we go closer to the mechanism both traditions target, the exact moment where reactivity forms and where each tradition inserts awareness. We will meet the fourth aggregate, sankhara, the concept that gives the whole picture its shape. Chapter 2, the body's conditioning. In Chapter 1, we met a phrase from MN 44, kāya-saṅkhāra, bodily fabrication, with the breath as its primary vehicle. That phrase sits inside a larger architecture, and we need to open it up now because the architecture is what makes the parallel with trauma science more than a coincidence of vocabulary. Buddhist analysis breaks the person down into what it calls the 5 aggregates. Panca khandha, in the traditional order, rupa, form or body, vedana, feeling tone, sanya, perception, sankhara, fabrications, vijnana, consciousness, not 5 separate things. 5 ways of looking at what is going on right now in any given moment of experience. The tradition uses this list as a map of what a person actually is, moment by moment, when you stop assuming there is a fixed self behind the process. A small note on numbering, because it matters and it is a common source of confusion. Vedana, feeling tone, is the second of the 5 aggregates, and it is also the second of the 4 foundations of mindfulness from MN 10. 2 different lists, 2 different numbering systems that happen to converge on the same term at the same position. Aggregates count what a person is made of. Foundations of mindfulness count where the meditator places attention. When we say sankhara is the 4th aggregate, we mean 4th in the list of what makes up a moment of experience, not 4th in the practice sequence. The 4th aggregate then, sankhara. The word gets translated many ways: fabrications, formations, mental constructs, volitional activities, conditioned things, conditioning itself. Underneath all the translations sits one central meaning: the accumulated pattern of how experience gets put together, how past conditioning shapes present response, how this moment becomes the material from which the next moment gets built. Sankhara is not just a thought. It is not just a habit. It is the machinery running in the background by which one moment gives rise to the next in a particular shape. And critically, this is where it matters for the trauma question. That machinery is not confined to the head. It runs through the body, which is exactly what Dhammadinna tells her questioner in MN 44. Bodily fabrication, verbal fabrication, mental fabrication. 3 layers, 1 process. In Thanisaro's translation, In and out breaths are bodily fabrications. Directed thought and evaluation are verbal fabrications. Perceptions and feelings are mental fabrications. 3 vehicles by which past conditioning shows up as present response. 3 interfaces at which the pattern is running, right now, in this moment, in this body. The tradition is naming layers of conditioning that go all the way down. Not just cognitive habits, not just emotional patterns. The way you breathe in this instant is kāya-saṅkhāra, the specifically bodily layer of your accumulated conditioning, showing up right now in the rhythm of your inhale and exhale. Change nothing else, and the breath still carries the whole history of how you have learned to be in a body. Fast, shallow, guarded, one signature. Slow, steady, open, another. The body is not a passive site where the mind acts. The body is itself a running record of pattern. This is the theoretical structure that lets the parallel with trauma science stand up. Van der Kolk's central claim, that trauma is held as a current imprint in the body, not just as a memory in the head, has, in the Buddhist framework, an entire technical vocabulary already waiting for it. Not a matching vocabulary, a parallel one, developed independently from a completely different question to describe what turns out to be the same territory. Consider what this distinction actually does when a practitioner sits down. When you take up the breath as an object of meditation, the first instruction of MN10, aimed directly at kāya-saṅkhāra, you are not primarily working on your thoughts. You are working on the layer of pattern that runs underneath thought, in the body itself. The thinking will continue. It always does, in early practice. But the tradition's claim is that the bodily layer can be reached and calmed even while the verbal layer is still active. The breath is the entry point precisely because it is the fabrication most immediately available to attention. Then, if the practice develops, attention can move to the verbal layer, the vaka-saṅkhāra of directed thought and evaluation. This is what the tradition calls, in later practice, the working of thought itself. Not the content of your thoughts, but the fact that thoughts are being produced in this particular way, with this particular quality, at this particular tempo. The verbal fabrication is a pattern too, and it can be seen as a pattern rather than as reality. And finally, if the practice reaches deeper still, attention can turn to citta-saṅkhāra, the fabrication of perception and feeling itself. The way experience gets colored before you know it is being colored. The way the sense of what is happening gets constructed in the moment of contact, before the story arrives. 3 layers of the same process: body, speech, mind, breath, thought, perception. The tradition maps the whole field of conditioning, and it does so in order to name where attention can be placed, what can be reached, what changes when the pattern is met with awareness rather than reacted to. This is not analysis for its own sake. It is a working map of intervention points, developed over centuries by practitioners who were investigating what could actually be done from the inside with the machinery that produces reactivity. Van der Kolk's body-based interventions work primarily on the first layer. Cognitive behavioral therapy works primarily on the second. Contemplative traditions that go beyond stress reduction work at the third as well. The Buddhist framework is not incompatible with any of them. It is more ambitious than most of them. Now to the mechanism itself. One of the most important texts in the tradition for understanding how conditioning becomes suffering is SN 12.2, where the Buddha lays out the 12-link chain of dependent origination, the sequence by which experience produces the very reactivity that keeps it going. We are not going to walk the whole chain tonight. What matters for our purposes is one particular stretch of it. 3 links in this order: phassa, contact; vedana, feeling tone; tanha, craving, sensory contact. The eye meets a form, the ear meets a sound, the body meets a touch, the mind meets a thought. Contact happens immediately before you decide anything, before you know what has happened. A feeling tone arises: pleasant, unpleasant, neither pleasant nor unpleasant. That is vedana, and the tradition insists it is not the same thing as emotion. It is the raw valence, the plus, the minus, the neutral, that arises the instant contact occurs, before any story about what it means. Then, and here is where the trouble starts, craving arises in response to the feeling tone. Pleasant feeling gives rise to grasping. Unpleasant feeling gives rise to pushing away. Neutral feeling gives rise to a subtler grasping, the wanting more of what is not yet quite satisfying. Tanha, thirst, craving. And from craving, the rest of the reactive chain unfolds. Clinging, becoming, birth, aging, and death. The whole apparatus by which suffering keeps producing itself. The tradition insists on this distinction, vedana as raw valence, not emotion, because everything that follows depends on it. Emotion is what comes next. Sadness, fear, anger, joy. By the time an emotion has a name, the reactive chain has already started to unfold. Vedana is what is happening a fraction of a second earlier. Before fear, there is unpleasant feeling tone at the meeting of contact and awareness. Before joy, there is pleasant feeling tone. The distinction is not academic. The window of intervention is precisely at the vedana level, before the feeling tone has been elaborated into a full emotional and cognitive response. Miss this window, and you are working downstream, trying to manage a cascade that has already fired. Catch it, and the cascade never has to fire in the first place. The entire sequence, contact, feeling tone, craving, runs in milliseconds. By the time you notice you have reacted, the reaction has already fired. This is not a metaphor. This is the tradition's description of a real temporal structure and experience. And this is where the parallel with van der Kolk becomes precise, not loose. When a trauma survivor is triggered, a sound, a smell, a facial expression, an angle of light, the body reacts before the mind knows why. Sympathetic nervous system activation. Heart rate up, breathing quickened, muscles tightening, the whole cascade of defensive response. The story about what is happening arrives afterward. Often, the story is wrong. The person constructs an explanation for a bodily state that has already occurred. Sometimes the story never arrives at all. The body simply acts, and the person is left with the aftermath and no clear sense of why. The clinical intervention point in van der Kolk's work is precisely the pre-narrative window. Before the story, notice what the body is doing. What is happening in the chest, in the belly, in the throat? Not what does it mean, not what is the memory attached to it, not what should you do about it. What is happening right now in the body? Notice that. What happens next? The Buddhist intervention point in the practice of satipatthana is the same window described in the tradition's own vocabulary. The second foundation of mindfulness is Vedananupassana, the direct observation of feeling tone. In MN10, Thanissaro's translation, when feeling a pleasant feeling, one discerns I am feeling a pleasant feeling. When feeling a painful feeling, one discerns I am feeling a painful feeling. When feeling a neither pleasant nor painful feeling, one discerns I am feeling a neither pleasant nor painful feeling. Notice what the instruction does not ask for. It does not ask what the feeling means. It does not ask what memory it is attached to. It does not ask what should be done about it. It asks the meditator to notice the raw signal: pleasant, unpleasant, neutral, and stay with it long enough that awareness catches up to what the body is already doing. The intervention point is between Vedana and Tanha, between the feeling tone and the craving that would ordinarily arise in response to it, between the trigger and the reactive story. Two vocabularies, two traditions, 26 centuries apart, same intervention point, the pre-reactive moment where awareness can enter the sequence before the sequence completes itself. Notice that. What happens next? And one discerns I am feeling a pleasant feeling are, in structural terms, the same instruction, aimed at the same location in the chain, targeting the same mechanism. That is why the parallel is not a coincidence of vocabulary. Both traditions have identified a real feature of how the mind and body work together. The fact that reactivity has a temporal structure, that there is a moment before the story arrives, and that awareness placed into that moment changes what unfolds afterward. There is one more piece of the Buddhist theoretical picture that needs to be in place before we can look at where the two roads split, because it is the piece that will make the divergence intelligible. In SN 22.59, the Anattalakkhana Sutta, the discourse on the characteristic of non-self, the Buddha walks his first students through each of the 5 aggregates in turn and asks the same set of questions about each one. He gets to sankhara, fabrications, the 4th aggregate. In Thanissaro's translation, are fabrications constant or inconstant? Inconstant, Lord. And is what is inconstant easeful or stressful? Stressful, Lord. And is it fitting to regard what is inconstant, stressful, subject to change as, this is mine, this is myself, this is what I am? No, Lord. The 3 characteristics, anicca inconstancy, dukkha stress, anatta non-self, applied to the very machinery of conditioning itself. Sankhara is inconstant. Sankhara is stressful. Sankhara is not self. It is not something you have. It is not something you are. It is a process running moment by moment, and the practice is not to fix it or heal it or make it more comfortable. The practice is to see it clearly enough that the identification with it drops away. This is a very different thing from what a trauma clinician means by working with the body's conditioning. The clinician is trying to restore the person's capacity to feel safe, to be present, to live fully without the chronic activation of unresolved trauma. Van der Kolk's endpoint is a nervous system that can move flexibly between states, a body that no longer treats the present as if it were the past. That is a legitimate and precious goal, and the practices work. The Buddhist practitioner, working with the same intervention point, is aiming at something different. Not a regulated nervous system, not a body that feels safe. The seeing itself, clear enough, sustained enough, direct enough, of how the whole process arises and passes, so that the process no longer produces the sense of a self at its center who is being harmed by it, or needing to be protected from it, or needing to feel safe within it. Same intervention point, same window between contact and craving, same instruction to notice what is arising right now in the body before the story. Different reason for the noticing, different destination at the end of the road. That is the question Chapter 3 has to face directly. What is the noticing for? What are the 2 roads actually pointed at? And how does an honest video for a serious audience name the divergence without pretending it does not exist? Chapter 3. Where they diverge. Start with Van der Kolk's endpoint, because it is the more accessible of the 2 and the one most people already have an image of. The goal of trauma-focused work, in his framework, is restoration. restoration of the capacity to feel safe, restoration of the ability to be present in the body without chronic background activation, restoration of what the field calls interoception, the accurate perception of the body's own signals from the inside, so that a full breath registers as a full breath, hunger registers as hunger, tiredness registers as tiredness, and the body's messages arrive undistorted by the residue of what happened before. This is not a small goal. For a person who has spent years or decades in a state of chronic hypervigilance, whose nervous system has been running defensive routines that should have shut down long ago, whose body has been treating the present as if the past were still happening, restoration of ordinary presence is the whole point of the therapy. Van der Kolk's phrase for it, in "the body keeps the score," is owning your body and mind, not conquering it, not transcending it, owning it, inhabiting it fully, so that it becomes yours again, in the way it was yours before whatever happened, happened. The clinical work that gets there is very specific. The interrupted defensive response, the fight or the flight that could not complete when the traumatic event occurred, needs to be finished. The frozen sensation, the held breath, the muscle bracing that never released. These need to move through the body to their natural end, so the nervous system can register that the danger is actually over. The stored patterns need to be reactivated in a context safe enough that the body can update its expectations, and the practitioner needs to learn slowly, over hundreds of small moments, that the sensations arising in the chest and belly and throat can be met with curiosity rather than fear. This is difficult, patient, expert work. When it succeeds, the person is not the same as they were before the trauma. They are someone who has integrated a difficult chapter into a life that continues. They can feel their body. They can be present with other people. They can hold both memory and now without being drowned by either. This is what regulation, in Van der Kolk's sense, looks like at the end of the road. A nervous system that can move flexibly between states and that returns, on its own, to a baseline of safety when the moment permits. That is one destination. Now the other, the Buddhist practitioner sitting on a cushion in the same body, working with the same intervention point, the pre-reactive window where feeling tone gives rise to craving, is not aiming at a regulated nervous system. This needs to be stated as clearly as possible, because the language of contemporary meditation culture has smoothed the distinction almost to invisibility, and the smoothing does justice to neither tradition. The Buddhist aim is not the restoration of ordinary presence. Ordinary presence, in the tradition's analysis, is already a form of dukkha, the low-grade unsatisfactoriness that pervades even the best of ordinary states, because every ordinary state is inconstant, and every inconstant state carries within it the seed of its own passing. The person who has fully recovered from trauma is still, in the Buddhist frame, a person for whom the machinery of conditioning is running. The reactive chain still fires. The self-sense still assembles itself moment by moment out of the aggregates. The suffering that has no cause anyone can point to, the ache of impermanence itself, is still there. The Buddhist practice is aimed at that deeper layer, not at trauma scale events, but at conditioned arising itself. The meditator sits with attention placed at the Vedana link and watches, over months and years, how feeling tone gives rise to craving, how craving gives rise to the sense of a self who needs, how that self assembles and dissolves and reassembles over and over, as long as the process is not seen through. And the practice is not to fix that process. The practice is to see it clearly enough that identification with it drops away. Panya is the word the tradition uses, wisdom, Not knowledge about the process from the outside, but the seeing through of the process from inside it. When the SN 22.59 question lands, is it fitting to regard what is inconstant, stressful, subject to change as, this is mine, this is myself, this is what I am? And the answer becomes, not intellectually, but experientially, no. Then the identification loosens, not because the body has been made safe, because the one who was asking to be made safe has been seen as itself another conditioned arising. This is not an intellectual event. The meditative tradition is very clear that reading about anatta, thinking about anatta, discussing anatta, changes nothing at the level the practice is aimed at. The seeing has to happen in the moment when a particular feeling tone arises, and the whole reactive chain is poised to unfold from it. And in that moment, the meditator sees directly that no self is being threatened, no self is being served, no self is present at all in the mechanism. The reactive chain does not have to complete. It can be let to arise and pass, felt and observed, without the imaginary center around which suffering ordinarily organizes itself. Over years of practice, that seeing deepens. The identification with the aggregates loosens. The tradition calls the endpoint nibbana, literally extinguishment. The ending of the fires of craving, aversion, and delusion that keep the reactive process running. A regulated nervous system is not that. A regulated nervous system is a precious and healing thing. The two are aimed at different fires. Here is the divergence stated in one sentence. Van der Kolk wants the body to be able to feel safe again. Buddhism wants the meditator to see clearly enough that safe and unsafe are themselves conditioned arisings, felt, observed, seen to be not self, released. These are not the same destination. Both are worth the journey. The parallel that this video began with, same location, different destination, is exactly true, and it is important not to collapse it in either direction. The trauma clinician who tells a patient that meditation will finish the therapy has misunderstood what the therapy is doing. The meditator who treats the tradition as a more efficient form of nervous system regulation has misunderstood what the practice is aimed at. Both errors are common. Both are courteous, well-meaning errors. Both flatten something that is worth holding open. The first error looks like this. A trauma survivor who has done years of body-based therapy, who is stabilized, who can be present again, is told by a well-meaning teacher that meditation will now complete the healing, will take them past the merely regulated body into some deeper freedom. This can be true, and it can also be a category error, because meditation was never aimed at the last mile of trauma recovery. It was aimed at something else. The second error looks like this. A meditator with a serious daily practice reads a book by a trauma clinician, recognizes the parallels, and starts describing the practice in nervous system language. Sympathetic and parasympathetic, activation and downregulation, window of tolerance. This can also be true in a loose way, and it can also drop out most of what the practice is actually pointed at. Both errors miss the fork in the road. There is one more piece of honesty that a video for a serious audience owes, and it needs to sit here before the close, because it changes how a person listening at home may want to receive everything that has been said. If you are living with unprocessed trauma, and the body often holds what the mind has not yet named, then standard meditation instruction to stay with the sensation, to notice what is arising, to breathe into the discomfort, can sometimes open a door that needs more support than a cushion alone can provide. A growing clinical literature has documented that mindfulness practice done without awareness of trauma, can worsen symptoms for a substantial subset of practitioners. Flashbacks, dissociation, re-traumatization, adverse effects that can persist. The clinical psychologist David Treleaven, in his 2018 book Trauma-Sensitive Mindfulness, developed specific protocols for teachers and practitioners to reduce this risk. The body practice is the right place. Both traditions agree on this. What the trauma-sensitive literature adds is that the pacing and the container matter enormously. If a listener carries an unhealed wound, the invitation to attend directly to sensation can, for a period, need to be met with more support than has been described here. A trauma-informed therapist, a skilled teacher, a slower and more titrated approach to the practice so that the door opens by degrees and not all at once. This is not a warning against the body practice. It is the opposite. It is an argument for approaching the body practice with the care it deserves, because the body practice is where the healing actually lives. Notice what the two traditions' closing questions share. Both take the felt sense of unsafety seriously. Both refuse to solve it by talking. Both point toward attention placed exactly where the sensation is before the story arrives. And notice what they do not share. One question asks about the body's needs. The other question asks about the one who has needs. One takes the needing self as the ground and works to serve it well. The other takes the needing self as the very thing to be investigated. This is not a small difference. This is the fork itself, showing up in what each tradition asks the practitioner to hold. So each tradition leaves you with a question. Different questions, and in their way, the same question asked from opposite sides. Van der Kolk's question: what does your body need in order to feel safe? Buddhism's question: who is the one who needs to feel safe? Not opposed, not identical, both worth carrying from here. Close. Return to the opening, the claim that started this video. You cannot think your way out of what happened to your body. Now the audience is you directly. You have been told, for most of your life, to talk it through, to reason it out, to understand what happened, and to let understanding be enough, to get over it, get past it, move on, to not carry the weight into another day. Some of that advice was good advice. Some of it was people not knowing what else to say. Some of it was the assumption underneath the whole century that words are the tool with which suffering is finally cleared. If you are watching this at 55 or 65 or 70, you have been given some version of that advice 100 times, from family, from friends, from doctors, from your own inner voice, borrowed from all of them. Two traditions, working from utterly different starting places, found something else. Not that words are useless. Words have their place, and this video has spent an hour and change on them. But the place where healing actually lives, in both traditions, is somewhere words alone cannot reach. The body is the practice ground, not the obstacle to be overcome. Not the symptom to be managed, the practice ground itself. MN10's instruction. One more time. Breathing in, the practitioner trains himself. I will breathe in calming bodily fabrication. I will breathe out calming bodily fabrication. This is not therapeutic management. It is liberation practice. It is aimed at a horizon further than most therapies name. And yet, it begins in exactly the same place the therapy begins. Here, this breath, this body, this moment, which brings the video to two words, held together, that carry both traditions, still here. For the trauma survivor, still here means something very specific. The wound is still here, not gone, not resolved, not processed away by all the years and all the sessions and all the good intentions. It is in the body. It is in the way the breath catches when a certain memory rises. It is in the tightness that lives, chronically, in the shoulders or the belly or the throat. It is in the startle, in the small stiffening, in the fraction of a second freeze when someone at the door speaks in a certain tone. It is in the way sleep does not come, or comes and does not rest. It is in the way certain rooms cannot be entered without a heaviness settling before you know why. Van der Kolk's whole life of clinical work is founded on this recognition. The wound is still here. The body carries it. And the body, precisely the body, and not the reasoning about the body, and not the story told about the body, is where it can be met, and slowly, over enough time and enough care and enough support, gentled into something less than what it was. For the Buddhist practitioner, still here means something else, but not something opposite. You are still here. The practice begins from exactly where you are, not from where you wish you were, not from the version of yourself that has already been healed, not from the version that has already awakened, not from the calm mind you would have brought to the cushion if the day had gone differently, not after the past has been finished, or the wound closed, or the story completed. From here, from this body, in this state, with this history, with this breath arriving right now, whatever it happens to be, fast, shallow, guarded, tired, aching, whatever it is. The tradition is very clear on this. If you wait to practice until you are ready to practice, you will not practice. If you wait for the past to be finished before you sit, you will not sit. The instruction is, begin here, still here. From exactly this, 2 words, 2 meanings, same location, and the 2 meanings are not separate. They are true at the same time, in the same body, in this moment. The wound is still here. You are still here. Both. In the same skin, in the same breath, in the same room. The trauma survivor who begins to sit does not leave the wound behind on the way to the cushion. The wound comes with because the wound is not a story that can be left behind. It is the body itself. And the meditator who begins to sit does not need to have healed first. There is no version of you that gets to skip this step. There is only what is here now. The wound is still here. You are still here. And here is where the practice begins. Both traditions, 26 centuries apart, arrive at the same first step. Notice what your body is doing right now, on the couch, in the chair, wherever you are watching this. Not what it should be doing, not what it was doing yesterday, not what it will be doing when the healing is complete or the awakening arrives. What is it doing, this moment? What is the breath? What is arising in the chest, the belly, the throat? Not what does it mean, not what should be done about it. Just notice that. And then, what happens next? Van der Kolk would then walk you, over months and years, toward a body that can feel safe again. That is a precious road, and it works. And for many people, it is exactly the road that needs to be walked. The Buddhist tradition would walk you, over months and years, toward the seeing of who it is that needs to feel safe. And, in the seeing, toward a freedom deeper than safety. Different destinations, same first step. Which road you find yourself on may not be a choice you make once. A person can begin with the trauma road, walk it for years, arrive at a body that can feel safe again, and then, at 60 or 70, feel the pull of a further question. Who is the one who has been made safe? What is this self that was so afraid, and what is it now? The Buddhist tradition has always been there for people who reach that question. It has not always been there in the language they know, and a person can begin with the meditation road, sit for years, and discover in the middle of the practice that there is old material in the body that the practice alone is not equipped to hold. The trauma-informed literature has grown up in the last generation precisely to meet that person. The roads speak to each other. They are not sealed off from each other, but they are not the same road. For a viewer sitting on a couch on a Tuesday evening in Ohio or Arizona or Wisconsin or wherever the signal reaches, holding a remote, carrying whatever life has been up until this point, both roads are open. Neither is easy, neither is fast. But the first step is the same, and it is available right now, in this moment, without any preparation at all. Notice your body. Notice what is happening in it, this moment. Notice that. What happens next? Still here.